First News with Keeler in the morning on WIBX and WIBX950.com.
WIBX.
This is Keeler.
WIBX 950 and 92.3 FM.
Now back to the Keeler Show.
I don't want to, oh boy, I got to say, Davey, where are you? Where is he? I don't want to rely on anything. I don't want to assume, Andrew, but I believe tomorrow Donna, who is out there every morning, Donna's a listener and a wonderful person.
Oh, yes.
And I believe tomorrow she's dropping off some holiday pie.
Hers are so delicious.
They're really, really good. Some pie. And the way this can work is Davey's not going to be here.
So we'll get.
So I think we split his. Don't tell him. So pie. She'll be in with some pie tomorrow.
Is that why you send him out of the room?
For the Thanksgiving holiday. I don't want him to hear it because he'll just show up. He'll be here. On the line right, Dr. Kent Hall. Doc, good morning.
Good morning and happy Thanksgiving week.
I call it the day before, the night before Thanksgiving. That's what it is.
Thanksgiving Eve.
Yes, Thanksgiving Eve. Okay, so I thought what I would do today, being that it's Thanksgiving, and we all know, what your doctor is recommending, what Dr. Hall is recommending when it comes to vaccines and that sort of thing. I do have to ask because we have talked a little bit about there are a couple of different types of COVID vaccines. Can you talk about those? How do you go to your pharmacy or your doctor's office and say, I want one, not this one? Is that something you can do?
So you can, although you may not be able to make a choice because
they might not have.
Wherever you go, they may only have one.
Okay.
So there are a couple. There are recommendations for gets them based on your age and your health status. There are some that are a little higher dose, and those are really recommended for people that are that have more of a propensity for severe disease. So the elderly and, people with significant comorbidities and things like that. They're all based on the testing. They all seem to be equally effective. So really it's just the added protection because of your own health status.
Okay. Okay, so you can ask, but you might not be eligible, and they might not even have the different kinds.
Right.
Okay.
Now, you're more likely to be able to get to have a choice if you go to a pharmacy than if you go to a doctor's office.
Okay.
Doctor's offices tend to get one, whereas pharmacies tend to have a larger stock.
Okay. I want to do this is a big, obviously Thanksgiving, a very big holiday where we tend to, really the whole month is like this, from holiday parties to cookies to all the sweets and the pies and all of that. So it is a time for bad habits, especially if you're trying to do the right thing and lose weight, et cetera, or to be healthy even. So I'm going to throw the habit at you, and then you tell us whether it's bad or not, and prevalent in the holidays, and why it's important to have a strategy. Okay, I think this will work. Unhealthy habit number one, which falls around the holidays.
I feel personally attacked already.
Overconsumption of alcohol.
Oh, okay.
Oh, yeah. Yeah, that's, when you're going to parties and things like that, that is definitely something that happens on a regular basis, unfortunately. So, my strategy, my recommended strategy for that is that you make a decision of how many drinks you're going to have. before you go. So, and my recommendation would be that you have no more than 2. I would also recommend that you have a designated driver so that if the first strategy doesn't work, you have a backup strategy in terms of getting home safely. It is very common to basically kind of lose count, or people keep handing you drinks, whether it's beers or mixed drinks or whatever. And so really, asking for water, having something in your hand, whether it's water or a diet soda or something like that, can really help to mitigate that and to minimize people just putting something in your hand, or you feeling out of place because everybody else has something in their hand and you don't.
Sometimes it's habit. Being in a party setting, having, like, you'll drink, Andrew drinks like non-alcoholic.
Yes,
the best non-alcoholic brand beer
that I've had is probably Athletic. Brewing Company.
Supposed to be really, really good. Yeah. Okay. I will tell you that my wife tricked me very much in an evil way recently.
And
it involved alcohol, because she said, think about your life, my life, of course. Now we're in the midst of an assessment. She said, really, when you think about it, every stupid thing done has been in your life, has probably been under the influence of alcohol. Mm-hmm. But here's the trick, Doc. I was in an argumentative mood and began pointing out all the other dumb things I had done. By the time I was done, her answer was, "Yeah, you do stupid things with alcohol or without." So she tricked me right into it.
Yeah, your wife's smart.
But the reality is, when you really think about it in life, some of the craziest, dumbest things you've probably ever done, whether when you were younger or today, probably ends up being under the influence of alcohol.
Well, and even to your own self, right? Like, that's the one thing I don't miss. I'll never wake up with a hangover ever again.
Yeah, well.
And those are the worst.
They are the worst. You're absolutely right. All right, unhealthy habit number 2 during the holidays.
Oh, boy.
Overeating, overconsumption of food.
Doc, that's not bad one day a year, right?
Well, but you feel like crap, though.
Yeah.
You do, and it is that, and I will admit that I suffer from this as well. So, this is, this is very difficult because it's you tend to, especially when you're going to a party and stuff, or you're going to somebody else's house for dinner, or people coming to your house for dinner, you have things that you wouldn't normally have necessarily. Yeah. You've got appetizers, you've got cheese and crackers before, and you've got drinks before, and then you've got and then you've got dinner, and then you've got how I don't know how many different iterations of pie or whatever it is that your dessert of choice is. And and it's a feast that lasts for for hours potentially.
It does.
So, so what you really need to do, again, this is first and foremost, really, I think with most of these, is you have to have a plan beforehand. This is what I'm going to do, and you need to. And it's helpful. Your wife may be a good choice for this. It is helpful to have somebody who will help you in a constructive way to stick to your plan. So if you tell somebody beforehand, hey, I'm only going to have, one serving of turkey or one serving of stuffing or something, and then, you start to weaken a little bit and you've got somebody there who can help you in a respectful way, then that also can keep you from overindulging. But these are great strategies, but the reality is that they're really tough to maintain.
They are.
Yeah.
No, it is what it is. It's you got to have a plan.
Yeah. Even if you told the person, be constructive with me, please just be honest with me. In the throes of having that second helping or third helping of green bean casserole, and somebody gives you the eye, it's hard to resist.
Did you know Campbell's has taken the word soup off their cans? We got to look into that and find out why they did that.
Really?
Yeah, weird.
Did they take it off of their cans, or did they just take it off of their corporate name?
Oh, maybe it's off their corporate name. Sorry, Doc. I just read the headline. Sorry. These are how rumors start.
This is why we have Dr. Hall.
Bad rumors come from the radio. Poor sleep, because everyone gets so stressed. Poor sleep can affect your stress, can affect sleep. It can affect your blood pressure. It can affect your eating, your overeating. It can affect even something as unhealthy as biting nails. Talk about allowing the holiday stress to get to you.
Yeah, so you're exactly right on all those things, and it is stressful because we want, it's stressful for a number of reasons. You're seeing people that you don't usually see. Sometimes there are there whether it's family or friends. Sometimes there are personal stresses from bygone eras, whatever. The most important thing there, I think, is to acknowledge that it is a stressful time, and not to actively disengage from conversations and from interactions that are going to be stressful. It's almost like having kind of a mindfulness, of just being in the moment and acknowledging that this is a moment, but it's going to pass, and that you are there as much as possible to have a good time, to enjoy company, even if company be difficult sometimes.
Yes.
But that's okay, because that's part of life too. And just realizing that you can just let this stuff go, because it's not something that you have to carry around with you. So really, if you have been into mindfulness, I think that is a good thing to practice before, maybe sometimes during and afterwards, to kind of bring your stress level down.
It is I wasn't even thinking about the dealing with interactions with people as much as the worries of having the money to be able to buy Christmas gifts or Hanukkah gifts or whatever it is that you're doing. But you're right. Having those holiday events where you're with people that might be difficult to deal with. Something for you to kind of think about. What do you think? Just pop a stress pill? Those can help, Doc. They can help.
I am not. While I am a doctor, and I have written prescriptions in my life, literally probably hundreds of thousands of them. I am not one that goes to medications right off the starting gate.
Okay.
For a number of differences, not the least of which, especially with these types of medications, is that they have an addiction capability, and so you really want to not jump to medications. On the other hand, if you have already been prescribed them for this reason, because your physician has said, you have a propensity for this, then you should follow your physician's advice. And if they say, that it is important for you to take a medication, and maybe even before you start having the interaction, then I think that you should follow that advice, because that's good advice.
And finally, this was brought up by Mike this morning. Wants you to pipe in, and it's real. It is the stress over opposing political views.
My gosh.
You're going to be sitting at the table. You're going to be drinking a few drinks, maybe. You're going to be mingling. And all of a sudden, the topic of politics comes up. Can be ugly.
So I will tell you that probably the worst combination is alcohol and different political leanings.
Yeah, you're right. Yes.
Little good follows those two things. What I would say is that, I would say, let's see, what does Ted Lasso say? Be curious, not judgmental.
Okay, fair enough. I like that.
So ask the question. If there's a supporter of the opposite side, whatever that side is, ask why. Ask questions. Tell me more. Help me to understand where you're coming from, and then truly listen. I think that if you do that, number one, you will educate yourself, and number two, the other person will feel heard, and the chance of the conversation veering off in a different direction, away from that more contentious issue, whether it's politics or whatever, or whether you like, the Cowboys or the Giants.
That's a good point. It isn't just politics.
Right.
People argue over the strangest things. And then you walk away thinking, why was I arguing over the Menendez brothers and whether or not they should get out of jail, right? Is it worth arguing over that? Are you really kidding me? Or was it the alcohol? Probably could have been the alcohol. Again, Doc, it all comes back sometimes to alcohol. Got to be careful. All right, good stuff. You've definitely given some healthy advice, Doc. We appreciate it.
No problem, everybody. Hey, have a great Thanksgiving. Have a great week, and please be safe.
You too, Doc.
You do the same. But I'll bet you there are 50 people right now, if there are 10,000, listening right now saying, okay, there's no way I'm just going to listen and
right.
Tell me more. Yeah. Tell me. I just don't see that happening.
Just maybe the classic rule of let's not talk about that.
Yes. That is a good rule.
Yeah.
And then you're at some point
you can
during
even
the
do an R, like a swear jar, but a political
every time.
conversation jar.
Trust me, telling you this is worth a buck. Okay, it's coming, Thanksgiving. So be prepared, I guess, is the way to do it. A friend gave my wife it's a wine glass.
Yeah.
That has basically a decanter all the way at the bottom of it. So as you pour it, it comes up into the glass, and a whole bottle of wine will fit in that glass.
That's awesome.
It's really a beautiful gift.
Oh, it'll be getting some good use on
I
Thanksgiving.
believe it will be, yeah.